we all see the world differently, and I guess that's what we're all saying up here, is that patients, all your people, because you've all been to med school and you've all been in training, that you need to embrace them. But it's not just listening to an individual, it's actually bringing them in and making changes to your practice. One of the main messages that came through from the work and learnings of the Care Coordination Project was that people wanted for cancer the message of hope. And they wanted the message of hope right through the journey, because it's a disease that can possibly kill people. Not so many these days, but it can, and they want to hear hope the whole way through. Designing cancer services directories on the internet, you know, we had a big input into that and to make it more user-friendly so people would actually go there and they'd be able to use it. On the national tumour groups, you know, giving the patient point of view. There's no point having services if people aren't actually going to go and use them. You know, things like parking, times of the day, who gives you your care, lots of sort of things that go just a bit further than the actual specialist treatment itself. We also assist with setting of priorities to the extent that we can outside what's required. And we also provide a bit of a reality check. I think there are times when we've actually sort of poured a bucket of cold water over a few plans because we've said, well, quite simply, it's not what people want, it won't work, it's a waste of money. And I think that that's been actually really useful to give that feedback, and in my view, probably we could do the same thing in primary care. I actually always find it really, really sad that when I go to a few of these cancer meetings and I talk about follow-up care to primary care, because I've got a great GP and I think GPs do a fantastic job, the people in secondary care are absolutely horrified that anyone in primary care could look after a patient who's a cancer patient for follow-up. Now, I mean, you know yourselves that your cancer patients get the flu, you know, they get a whole range of things and they come and see you all the time. So, you know, I think there's work that needs to be done there to coordinate primary and secondary care. I think that medical care, whether it be your GP, whether it be secondary care, whoever, I think we all have to work together, including the community. I think that's where we get the best value.